everyone. So I'm recording this video to help out with this class project. So I hope this is reaching you and will be helpful for you. So to introduce myself briefly, my name is Brandy Becker-Wright. I am 34 years old. I live in a suburb of Detroit, Michigan. I've grown up in Michigan and lived in Michigan all my life. And I want to tell you a bit about my work as a clinical social worker. So, as you can probably see from my shirt, it says hashtag end ALZ, and that is because I am an employee of the Alzheimer's Association Greater Michigan chapter. My actual job title is care counselor, which is essentially a social work role. We have some different versions of care counselors at the association. And what makes my position a bit unique is that I am actually a part of our embedded social work program that we have, where I am primarily stationed within the Henry Ford Health System, the hospital system, in the neurology departments in what they call the memory clinics. So, typically, when someone has dementia or is concerned that they might have dementia or Alzheimer's, the types of doctor that we recommend that they see are neurologists. And so, the neurologists that I work with through Henry Ford are those who have a special interest in aging and dementia and diagnosing and treating Alzheimer's disease and other dementias. So, like I said, my role is specifically as a care counselor, but directly in the hospital system. So I work right alongside doctors, nurse practitioners, nurses, MAs, who are working with patients and their families as they go through this journey from the very beginning and often all the way until the end. I just recently started this role, but I have been with the Alzheimer's Association for 6.5 years, so I've kind of bounced around positions a little bit. But this role is pretty new to me, so I'm still kind of getting the hang of it. But when I read the post about what this project was about, I thought that I would love to share my experience with you. So, to answer the second question about what kind of education is required and what my personal journey sort of looked like, to have my actual exact position, a master's in social work is required. So that is what I have. However, to work at a place like the Alzheimer's Association, there can be many different types of degrees depending on what you're doing. Most of our positions require at least a bachelor's, but a lot of times they're not in anything specific. We have people who studied gerontology, we have people who studied psychology, sociology, social work, and other things like that. So, I will spare you all of the details about my exact journey because it was very long and winding. But I guess what I will tell you is if, for example, you wanted to end up in a position like mine, first and foremost, you would need to get a bachelor's. I got my bachelor's in sociology, which is a kind of a stepping stone to social work. But truthfully, social work is kind of a cool field in that many people who come into like a master's program for sociology, or I'm sorry, for social work, don't actually have any social work experience. Maybe they were a math major or a history major or whatever. Essentially, as long as you have a bachelor's in something, you could apply to get into a master's of social work program. And then for my specific journey, along the way to getting my MSW or my master's in social work, I also got a master's of arts in family studies. It wasn't at all necessary to do what I'm doing, but I'm just sharing it with you because I did. And then I got my master's in social work actually not all that long ago in May of 2017. I got that degree while I was working full-time at the Alzheimer's Association. For me, though, I think the biggest pathway that got me to where I am is also through work experience because as I was out of undergrad, I began working at an adult foster care home for people that had mental illness and traumatic brain injury. And it wasn't something that I really thought that I would be interested in, but as I was there longer, it became more of an interest. And it kind of pushed me into sort of this mental health, helping people, almost therapeutic kind of setting. And I think that is what sort of pushed me into thinking about social work. And then ultimately, the reason I ended up at the Alzheimer's Association is because I moved across the state. And when I was looking for jobs, the first position I held at the association was very similar kind of to the position I had at the group home. So I would say that work and life experience also very much painted a big role in where I ended up. Third question, how does my work play a role in public health, population health, or health prevention and promotion? So, Alzheimer's disease and dementia and related dementias are a huge health crisis. I would say a global health crisis, but definitely a national health crisis. And for those who aren't familiar, I wanted to share just a couple of statistics for you to kind of show you how much of a problem this really can be. So I apologize, I'm going to be glancing at some notes, but we actually just released the 2019 facts and figures through the Alzheimer's Association less than a month ago. And so these numbers are all coming directly from that report. But currently there are 5.8 million Americans living with Alzheimer's disease right now. That's a lot of people, and it went up from last year, which was 5.7. Alzheimer's disease is currently the sixth leading cause of death in the United States. That statistic surprises a lot of people because they hear so much about some of the other top causes of death that they don't really hear about Alzheimer's as much. Also, if you see the list of the top 10 causes of death in the US, one thing that I think is really important to share is that Alzheimer's disease is the only one in that list of the top 10 that has no real way to be prevented, no way to be treated or slowed, and no cure. All of the other things in the top 10 have at least one, if not two, if not all three of those things. So basically, we are defenseless against Alzheimer's disease right now, which is why we really need to push along research efforts and funding for research and things like that. Also, I'll share with you quickly that the number of deaths from Alzheimer's disease has grown 145% between the years 2000 and 2017, whereas many of the other top killing diseases, those percentages have decreased. Alzheimer's continues to climb, which is a huge problem. And then the last thing that I will specifically share with you is that $290 billion is the estimated amount that Alzheimer's disease and other dementias will cost in healthcare, long-term care, and hospice in the year 2019 alone. And again, these numbers are expected to rise dramatically. All the baby boomers are just starting to come into age of around 65, so we're expecting to see huge increases. So, how does my role specifically play into any of these things? So I would say a big part of what I do is meet with families while their loved one is getting examined, getting tested, like cognitive testing, to gather subjective information. And that's really important for someone that has memory loss concerns because they may not even be aware of their concerns. They might be in denial. They might not be an accurate reporter of what's going on. So we always have them bring family or friends with them, try to provide some additional information. So a lot of what I do is gathering that comprehensive information that can go and be reported back to the doctor to help them make the most informed diagnosis possible. I also provide a lot of brain health education. It's another big piece of my role. We talk about things like physical exercise, mental stimulation, social engagement. These are all things that are super important for people, all people, whether they have any kind of cognitive impairment or not, to keep their brains functioning at the highest level. And then I also provide a lot of support, a lot of education. I provide resource listings and resource suggestions, and just really a listening ear for many of the people who are going through this journey. And so, although I may not personally be doing much to prevent the disease, slow the disease, cure the disease, the big part about the Alzheimer's Association's work is that we are not only pushing for a cure, pushing for prevention and treatment, but we're also helping to support all the individuals who are going through this right now. We can't just let them suffer until we find this cure. What do I love about my job? I love the cause. Before coming to the Alzheimer's Association, I was very lucky to not have it really have impacted my family too much. But very quickly, being a part of this organization, you really get sucked into the power of what memory loss and what dementia does to a family and to a person. It's devastating, and you can't help but just be drawn to wanting to help and wanting to do anything you can to just prolong the quality of life of these individuals and their families who are caring for them. So I love that part of my job, that I am a resource, that I am a source of knowledge, that I am, again, that listening ear for people who need it. The other thing that I like about my role specifically is that I feel very much appreciated by the medical community that I work with, as well as by the families. So, the families I've kind of already spoken to, but the medical community, it's amazing how much the doctors and the nurses and everybody is so appreciative of the role that we play in this multidisciplinary team. I think that not always is that the case, but in this case, they very, very much appreciate what we can offer to both their knowledge to make a good diagnosis and also to the people who are coming in to see us. Last thing, what advice would I give to people who are pursuing maybe a career in health? So I can't really speak to those who are going for sort of that true healthcare of like a doctor or a nurse or something like that. But what I will say about something like social work is to let your passion drive you. If you don't truly love what you're doing, you probably won't last. Social work is a field that has a very high burnout rate. It's often because we throw ourselves out there and working with the most vulnerable people, the most difficult people, the people who need a lot of support and a lot of our time and effort, and it's easy to take that home with us. And so if we don't absolutely love what we're doing and love the populations that we're working with, we are much more likely to burn out. Also, I hate to say it, but social work pay is not the greatest. So if you are in it for the money, you're not going to make it. I would say another piece of advice is that you will not always be told or shown that you're appreciated by your clients, by maybe even other people that you work with. But you are. And it's important that you know that because the people who tell you, those comments will far outweigh the people who are upset with you because you don't have a magic answer for them. And the last thing, it kind of goes along with the first thing, is just find a cause, find a population, find a setting that you believe in. If you don't feel like the organization that you're with has the same values as what you hold personally, I think that's very difficult. I think it would be very difficult to work in a place like that. Because again, it kind of blocks that passion from really shining through. So don't be afraid to be a little bit picky and find something that really works for you. All right, well, this was very long, and I don't know the length we were shooting for, but I hope it was helpful. If anyone has any questions, I'm happy to share my contact with Melissa that can be passed on. And if you want more information about Alzheimer's or dementia, you can check out our website, which is www.alz.org. Thanks, everyone, and good luck.